All right. And
Hey, we
so
live.
share it out. Y'all know how this goes. I'm going to try to share it from my phone this time, see if it's faster.
It might be.
I was driving in the car. I was like, why don't I just do that?
Let's see.
My page. So let's find out if I'm live. I am live. There we go.
Let's get it. Yep, I see you.
Boom. Mm-hmm. Mm-hmm. Who's on? Joseph lives to tell the tale. What's up, Matt? Anthony Maritato, what's up?
Yo, people don't real. Yo, and I think he's talking about boards, man.
Yeah, how did it go?
Yo,
Tell the masses.
we survived, y'all. We don't know the score yet, so. But right now, we just praising God for making it this far. You know what I'm saying? But I don't know. Like it was good. When they send me the thing saying that I passed, then I'll talk freely about it. You know, you can't get too comfortable, and then it's like, oh, so I said all that stuff last week, but I didn't really pass. You can't have that happening. All right.
So can you tell the world how different or how similar this is to boards? The GRE compared to the NPTE.
You know what's funny? I was going to do a live about that. But yeah, I think it's similar in the sense, in the aspect of endurance. You feel me? Like, I honestly feel like I was just through the practice exams, I was really training myself to stay looking at that screen for more than an hour, man. And so GRE was very similar to that. It was the first exam prior to going to PT school that I had taken that took that much time. And I know we're all used to 50 question exams, some multiple choice, some fill-in and whatnot. But GRE was very much an endurance test. So for those that have not taken the GRE yet, yeah, man, it's very similar. But I think exposing yourself to the content before, and I'm not going to lie, I didn't study for the GRE too hard. And I'm not saying that as a piece of advice. I'm just kind of looking back now. But I think what I had to prepare myself mentally on was just how the structure of the test was to begin with. So being able to understand, okay, this is how the format is. They even, in the book that I had, it gave you tips on really how to read the questions, how they wrote the questions. Obviously, you can always knock out two answers as being, you can kick it out, and then you have two answers that you're really kind of wrestling with if it's a 4-question multiple choice thing. So it's very similar in that sense. It's different though in the sense that with the PT board exam, it felt like I had encountered most of it. It seems weird, but with the GRE, because the GRE is a little bit of everything, you have some of this, that, and the other things that you've supposedly learned throughout high school or college or whatever. I had areas that I knew I was better at. I was better at math at the time, and there was other areas I was like, this is going to be a stretch. Whereas with the PT board exam, you've spent the last 3 years just kind of saturated in all of this content. You know what I'm saying? And so I think that was the biggest thing for me. But yeah, man, I think they have some similarities, but I'll do a live once they tell me, that I passed, so that I can, say it in.
True that.
In excitement.
All right, so let's get started. Let's make this one, or try to make this one, a little bit interactive. I think the other ones were kind of more lecture style. Yeah. So everybody who's on, I'll try to get to all the groups and pages this is shared to. but
Mm-hmm.
go to my page, Casey Coleman, watch it on there, and drop below your one word or your one sentence definition of what physical therapy is like to you. What
Mm.
like if you had to tell somebody, either a patient, someone off the street, someone says, "Oh, you're a physical therapy student. Oh, you're a physical therapist." What is that? Like, what can you do for me? So drop below your one sentence definition of what physical therapy is to you. Sum it up real quick. Let's see
Mm.
who else we got here. Oh, Jonathan. What's up, Jonathan? He's asking what state did you take your boards in?
I took it
Or what
for
state? No, what state did you take it for? I guess
I
is what
took
he's
it
saying.
I took it for Texas, but I will not be practicing in Texas. The reason I did that was because I'll be in Florida actually, so that's where I'll be practicing in the Tampa area. But for how I was gonna, they essentially were not gonna let me take it early simply because I wasn't done with my internships yet. So because I'm in Texas right now for my rotation, I figured, hey, why not take it for Texas, then transfer my license over afterwards because you can do that. I didn't want to wait till October, knock it out now so that I mean, this is what I wanted to do so I could graduate and have that already taken care of.
Right.
But that's why. But I took it for Texas, but it will be transferred to Florida after that. So, yeah.
Cool.
All
So
right.
Melissa Lopez says physical therapists are movement experts,
True.
and
That's
Jonathan
true.
is saying hands-on body doctor.
Hands on. Yeah, that's probably my favorite one right now. Hands on body doctor. You know what's funny? As we get into this topic, I think there's like when we're passionate about something, it's very easy to try to pass it on to other people. And that's why I feel like this topic is really important tonight. There's some young high schoolers that have been coming into the clinic that I'm at currently doing my internship, and they're thinking about physical therapy and some other stuff. So they're doing their job of, they're really observing, which I wasn't doing in high school. And I commended them for that. However, like I caught myself. We were talking early on with two of them, and they were like, "Yeah, like what got you into physical therapy?" And so I started talking about my journey into how I got into physical therapy. Then I started asking them questions, and I was trying to persuade them to do PT. And I stopped myself. I was like, "Y'all, listen, I can't do that to you guys. I can't because I'm pretty sure that if we had a long enough conversation, I could have persuaded them to really consider physical therapy, but it wasn't fair of me to do that. And that's why I think this topic tonight is so important. You have to understand what it's all about. What's the big picture and how do you fit into it? In terms of your personality, in terms of the things that you're passionate about, in terms of your goals for your life, in terms of just what you want to do for those around you. And so this topic is very crucial because of that. We can all, I mean, Casey and I could come on here and tell you why you should be a physical therapist, but I think there's a lot of that. But I think it's better for us to come on and tell you really what physical therapy is all about. What do physical therapists do? What can you expect? Obviously, you guys can ask any question. We'll talk about it here. But I think that's why this is crucial.
All right. So I can. You want me to go first, or do you want to go first?
Start it, homie.
Like, what's your definition? Well, I wrote a blog about this. Let's see when I wrote it. February 17th. This was right after or somewhere around CSM.
Mm-hmm.
And basically my little definition of physical therapy was function and movement to its maximum potential before and or after an injury. So physical therapists optimize function and movement to its maximum potential before and or after an injury. Now we can break that all the way down and say, what is an injury in the first place? An injury can be ACL tear, something common like that. It can also be a stroke. It can also be a vestibular issue, jaw problems, TMJ problems, just a surgery in general, because that's injury on a video or in person. That's an injury. So that's my short definition of what physical therapy is. Like we optimize function and movement to its max potential as best as we can do before and or after an injury.
Yeah, and that's exactly what it is. And I think the biggest thing that really kind of draws us to physical therapy is really that, because Movement is what allows us to do everything, right? I can't go to my car to get the groceries if I don't have a way of getting there. And so optimizing, I mean, for one person, it's getting them to run back, on the soccer field and whatnot. For someone else, after maybe a spinal cord injury. So say that again?
You're good. You're good. Keep going.
All right. So for someone else, after maybe a spinal cord injury or something like that, like they may be at a point where they're not going to be walking again. And so for them, it's for the movement they have left. How can we get them from their wheelchair to their bed? Like it's giving someone back their independence, allowing them to reclaim themselves, like what they want to do. And so if we can do that for somebody, doing our best to even avoid the surgery. Now, when it gets to that point, it gets to that point. But if we can do our best to help them avoid that, obviously we have the opioid epidemic, right? So this thing where I have back pain, let me go get something to take care of the pain. I have this pain, let me go get this pill to take care of that. And so for us is how can we get them to be able to do everything they need to do again? Identify what the problem is and help them like functionally through that so they can be able to do it again. And so that's what that definition in itself is what really pulls me into PT because you're giving people back their lives. That's what you're doing. And I think that's where the golden ticket is. And so that's what I love about it. And that's definition wise, that's what it is. Given we'll go into details about different areas and whatnot. But that's it. I've heard movement experts. I've heard movement doctors. Movement is big. If I used to golf and I have a hip and knee pain, that's been affecting me for the last 4 months, I haven't been out on the course. I haven't been able to hang out with my buddies that I always hang out with because I'm always golfing. Simply because of this thing, the pain meds I'm taking, they were working for the first month, but now they're not working as much. Like, what do I do? Like, for me to be able to help someone through that and help get them back to the, golf course. And now, I mean, in case he's caddying and all that, but like for me to be able to help them through that, that's then the role of the physical therapist. And we're everywhere. You have us in outpatient clinics, like outpatient ortho clinics, inpatient. So you have acute care, you have SNFs. Inpatient is anywhere where someone is staying overnight, essentially. Sometimes for a few days, other times for weeks, months. We go everywhere from geriatrics, where you're dealing with older people, to pediatrics, where you're dealing with younger people. The most common one that people always gravitate towards, sports, is there as well, where you can work with professional teams, you can work with local teams, and be on the lookout for sports as well. We have a podcast coming up in a few weeks where we're breaking that down with the former strength and conditioning coach for the Los Angeles Lakers. And so we'll bring that in here, and you guys will hear all about that for those of you who are interested in sports. But there's sports. Casey was talking about injuries after surgeries, because after a surgery, someone is in a lot of pain, obviously. If they got a new knee, they have to learn how to use it again. They have to get strong enough. They have to learn how to control the pain. And so that becomes where we step in. So I think it's a beautiful profession because of that. But that's what we do.
All right. So let's touch on some other things PTs can do on the clinical side.
Yes, sir.
Because I didn't really know as a pre-PT like everything we can do. I thought it was just like hospital patient, like a majority of pre-PTs do. So
yeah.
Some things I have down are pain specialists. There's a big movement, I guess you can say, or a big interest in pain and chronic pain and how we should treat patients like that. What else we can do is like neurologic rehab, either stroke patients, spinal cord patients, cerebral palsy, pediatrics, if they have like a neurologic, not necessarily, well, it could be an injury from birth or something like that, or if they're born with like a genetic mutation or something like that, we do that rehab. Also amputees, we work with them. Wounds care is a small niche, not for everybody, but some people do like it. Cardiopulmonary specialist, if you like the heart and lungs, how that all works. If that's your forte, go for that. Acute care, like I mentioned, TMJ, that's jaw problems, dysfunctions, things like that. There are some running specialists. The fancy term for that, if you don't know already, is called gait. So if you're in marathons, sprinting, things like that, you can look on the biomechanics side, physics into that gait pattern. What's the most functional way to walk, run, move? What else do I have? Pelvic floor. If you're into women's health, pelvic floor is a good niche to get into. Then I have that. And my last thing is just orthopedics, like your normal sports injuries, shoulder pain. It's not really a sports injury. I guess it could be like rotator cuff, ACL tears, ankle problems, ankle sprains, like your normal stuff. So that's just a basic overview on the clinical side of some things you can do. So since you were on clinicals, have you seen anything in particular that interests you?
Bro, I've seen a lot of things that have helped me identify some of those things that you were just talking about. I've seen some amputees. When I was in the hospital, I saw a lot of things with the lungs. I mean, where someone's coming in and they're sorry, I did my clinical with wait a minute. Calvin, we got to talk to you. We need to speak. What? Sorry, my bad. I got off track. But I haven't been with a sports team like that though. So that's pretty dope. I think the most fun I had though, personally with my internships was twofold. Working with the older population, so geriatrics, and a lot of that was really a lot of back things, and so stenosis and all that stuff. But also like some younger athletes, and it wasn't necessarily because I want to just do sports or whatever. But it was just nice to see that spectrum where you go from someone that's like super old and they can really say anything they want and no one gets upset and it's hilarious, to someone who's younger and all they want to do is get back to playing soccer, because I saw a lot of ACLs and like those kinds of tears from soccer injuries. Saw some basketball players that were doing their thing, baseball players, so a lot of like arm and shoulder stuff. Working together with also occupational therapists too was a lot of fun, because with physical therapy, and you see it most in the hospital, but you're part of a team, structure where for the patient's care, you have obviously the doctor, the nurses, the therapist, which is now the PT, physical therapist, occupational therapist, sometimes speech therapist, especially when it's something that affects, how they swallow, speak, all that stuff. But for mine, it's been pretty cool. A lot of the cooler ones have been seen by other PTs, and I'm like watching them across the room in the clinic. So that's pretty dope overall. And so,
Sorry, it's getting dark.
Oh, you good?
Yeah, turn on the light.
I bet, man. But I think one thing I wanted to add with physical therapists is there's three things that make us really unique. And those three things are: one, not really unique, but I think when incorporated, they equal a dynamic trio, essentially. Is one, we're teachers. And so that's one thing to think about when you're considering physical therapy, is just the ability to just try to break something down to somebody else. Once you understand it, I mean, something I was always told is like, if I'm studying something, if I can explain it to a kid, then I understand it. And so it's the same thing. And so with people coming in with their different ailments, they want to understand what's going on. Like, why is my back hurting? Why can't I sleep all night? Why can't I walk? Why I had this surgery 2 months ago? Why is my knee still not working the way it needs to? Like, for you to be, I mean, you'll understand it because that's what PT school is for. But being the teacher then really helps empower the patient to really understand first what's going on so they can also buy into it. Secondly, we're motivational speakers. So you don't have to be Eric Thomas to be a motivational speaker. You can be a physical therapist, because regardless of what the patient is coming in for, they need you to first of all, let them know it's going to be okay. But once that takes place, then you say, all right, like this is where you're at right now, and this is where you want to go. This is your goal as the patient. This is where you want to go. We got to get you there. So initially they might be pumped, but partway through, it's very common for someone to get frustrated, having an off day. Maybe it's not going as fast as they want it to go or whatnot. Like that's where you step in. You remind them of where the goal is. Where are they trying to go? You become that person that helps drive them, like motivate them towards where they want to be. And once they get there, they're going to thank you for it. So 1, teachers; 2, motivational speaker; number 3, we're listeners. So if you like to only hear the sound of your own voice, it might be kind of hard to help somebody when you don't really take the time to listen so that you can understand what they need you to help them with. And so if you can learn how to do those 3 things, even before getting into physical therapy school, you will be a phenomenal physical therapist. Being a teacher, so learning how to teach. And right now, if you're in high school, like start teaching your little siblings or your cousins the stuff you're learning in science class or whatever. It seems kind of crazy, actually. But those are things that train you. Our mentor, Greg Todd, talks about doing like Facebook Live videos and whatnot, which is excellent as well, because it really, like you practice, how to speak to people. And really, like, as you say, you're like, man, maybe I didn't know it as well as I thought I did. And so that's it checks you, so that you understand things before you try to explain them. Motivational speaking, like really, I mean, listening to people motivate you is also like, it passes on. Like I listen to a lot of, Eric Thomas, let's start with him, but I listen to a bunch of other like motivational individuals, period, whether it's through their books, reading their content, or their YouTube videos, or their lives, or whatnot. But you have to be motivated. You have to be motivated yourself in order to motivate them. And then lastly, just learning how to listen. Like don't like close your mouth just for 2-3 more seconds. Especially in the awkward moments when there's that awkward silence and you feel like you have to say something. Once you master that, it's game over. Now all you got to do is do the coursework, take the board exam, get a job, then open your own clinic, and then you making money, and you're having a blast because you've mastered those things.
Hey, I love it. So we got on the clinical side, and we got like, what are 3 things you need to know before being a PT student and even a PT. So so jumping on to the business side and how to make some money from this. So am I still here? Let me know.
Yes, sir. Yep.
All right. So I just put up a question. What do you want to do with your DPT degree? And we have an answer to this in the pre-Doctor of Physical Therapy students group. Damian Johnson, what's up? He says travel therapy to get the debt down and gain experience, but ultimately opening his own practice. So congrats, you got this. Yeah, that's another discussion. We can do that on another time too. That's another topic.
We can talk all day.
Learning about it. Let's see what else people have now here. Nothing yet, but yeah, drop them down. So. Yeah. So some things you can do just right off the cuff. Travel therapy clinic, like you said, like Damien said. You can do some liaison work, which I just found out from, well, not just found out, but more familiar with now because of an article from Covalent Careers, I think it was from. Yeah. You can do, some insurance companies do. So you'll learn when you get on in your clinic rotations and stuff. There are other people on the other line of this insurance thing, right? Tracking everything you do and like why your patients need this therapy, need this coverage. Do they need more days, more money and stuff like that? So you can be on the other side or a consultant for these insurance companies. That's another thing you can do. You can be like an ergonomics consultant for like big companies, UPS, or just like desk jobs like say Google, Apple, whatever people sit all day, trucking companies, other moving companies, just things like that. Branch out, like just like have your eyes open, kind of widen your horizon. Cause I really didn't know about all these things until let's say year and a half ago,
Yeah.
maybe like all these things you can do. What else? Online wellness, online physical therapy. Once you have your degree, that's some things just off the top of my head. But what do you have? What comes to you, Joseph? What
You
else
hit
can
a,
we do as a PT?
you hit them all. It's funny. I had a conversation with somebody not too long ago, and they were saying they were talking to me about the fact that when you're a nurse, nurses have. I mean, for those of you that are familiar with the nursing profession, there are different things you can do with a nursing degree, um, and and some of them don't require you like going into the patient's room and whatnot. I don't know what they're called, but when a patient's in the hospital, the person that's essentially like the mediator between, like the case manager, I think is what they're called. And so you can become a case manager and you're a registered nurse and whatnot. And so the reason why we're having that conversation is why is it that like a lot of people really have this very limited perspective of what they can do with physical therapy? Whereas certain other professions have identified the fact that they can still use their skill sets in other avenues that are not the standard way of practicing in that given profession. And so with physical therapy, it's everything you were just saying, Casey. But then remembering that, and I think, for example, with the whole thing about like training, like physical training, athletic training, whatever, like there are different professions like athletic trainers, coaches and whatnot. But in physical therapy, you are trained on the human body in all its facets. And so with a doctorate in physical therapy, you are well equipped to do a whole lot more than most PTs think they can. And I think there's this limitation factor that, oh no, we have to stay in our lane or whatever. No, like, that human body well. You know what I'm saying? Like, how the body moves, how things work. Like, especially if you yourself are very active, if you're into CrossFit and whatnot, you can incorporate it there. And so I think now, especially with the virtual platform, like social media, all that stuff, whatever, like we can do whatever we want with it. If it involves movement, like if someone came up with something new today or tomorrow that involved, like, that's something that they are equipped to do. And so I think there are untested areas, untested horizons that really can utilize this profession. And so this is why you have to, one, like, really know about it, really know that you're passionate about helping people in this way, and then bring on your skill sets, bring on your passions. If you're techie, if you're into fitness, if you're a runner, Casey was talking about like running specialist. If that's what you do, you incorporate it there, because the human body is the human body, whether I'm rolling a wheelchair, shooting a hoop, like swinging my golf club, running into somebody, trying to tackle somebody, in a football game or whatever. Like, the human body is the human body. And so I do think that on top of what Casey was just saying, there are some untested horizons of what we can do as a profession. And I think our profession is waiting for that. Not everybody will be on it. Like, not everybody will vibe with it initially, because that's how change happens. There's always someone that's got to, be the friction. But it's going to be that much more necessary, because if it's serving a population, it doesn't matter if it's a biker, it doesn't matter if it's like anything, like with skateboarders and whatnot, like, it doesn't matter. If it serves a population, period, you are equipped to do it. And I think that's the advantage of having that degree. Is you have to really, like, to get through it, you have to understand the body. You have to understand how people work too. Like, the social aspect, you have to be able to relate with people, listen to people, understand people, and whatever problems they got, you solve it.
Yeah, let's see what other comments we have. I'm trying to look in all the groups and all the pages. So I'm like, oh, what's going on? So Melissa said her brother used to work for NASA, and they had PTs come in from the human factors department to come give presentations to employees about work economics and how to prevent work injuries. So exactly. Exactly. She also mentioned canine PT. She said that's pretty new.
Oh, we forgot about pets, man. Like, animals. Yeah.
Animals, all that. What else? Inventions. You can come up with your own invention. I'm not going to go get it now, but I have a Theracane body back buddy. I think that's what it's called. Who knows? You can come up with something like that. You can teach clinical courses like MedBridge, Ice Fizzy, Institute of Clinical. If you really like that clinical side,
Mm-hmm.
I hope my internet's. I see me shaking and
I hear you, bro.
pausing.
You good? You good?
I'm gonna wait a second. All right. So yeah, if you go through school and you're really good at orthopedics, or you're really good at the shoulder or the knee or stroke therapy or whatever, you can monetize that and teach courses, and you get what's it called, CEU. Well, people. So let me go back a step. Once you get your degree, in order to maintain your degree, you have to have, depending on your state, 24 CEUs, continuing education credits. So what you do is go to these people who teach you about the shoulder, knee, neck, back, in more detail and more depth, and it's like a weekend intense course. So what you can do, if you like that, if that's your specialty, that's what you love to do, you can monetize it and sell. I think I'm sure you have to go through the APTA and get accredited or something like that. I see me shaking, so I'm gonna pause a bit. Get accredited for like the courses and continuing education credits, but that's another option you can do as well. Also, if you like business, you can do a business online course. We know some people: Jerry Durham, Aaron LeBauer, Paul Goff, Nick Todd. If you end up owning a practice and you do very well and you have a specific system that works for you, you can teach other people how to do that and open their own practices and make money that way, and also have your clinic running in the background. Like, whoever tells you cannot make money in PT, if you want to do the bare minimum, you might be stuck with 60, 70,000 a year. There's options for you. There's plenty of options. So the options are incredible. What else? Podcasts. We have a podcast ourselves.
Yeah.
You can do fitness and wellness training, online consults, in-person consults, things like yoga. I think I saw CJ on here. Let's see where he is. I don't know if he's still on here. CJ Carmen Joseph. Yep. There he is. The movement doctor on Instagram and Facebook and stuff.
The one and only.
And he works out of a CrossFit gym. If he's still on, he can correct me if I'm wrong, but I'm not sure if he owns it or not, but he works in a CrossFit gym. Also, Mitch Babcock. He's also working out of a CrossFit gym. Our good friend, Cruz Romero. I'm not sure if Exos is a CrossFit gym. I'm not sure how that works, but there's some people in that space. If you really like athletic training, CrossFit, things like that.
Yes,
Daimir Jones, I'm not sure if he's on here, but he does a lot of that as well. So, the possibilities are endless. And I'm sure I'm leaving a lot off the table. But in writing notes down and, saying stuff that comes to mind, that's some things you can do.
Yeah, and I mean, everything you were touching on is perfect in the sense that now, especially now with like things like podcasts, videos, YouTube, all that stuff, whatever, you can also like share with your communities. I mean, they're on their Facebook too, they're on their Twitter too, and all that stuff. And so for those of you kind of terrified about the whole like going into a private practice, there are so many different like most PTs aren't even using them because I don't know if they're scared of them or whatnot, but ways to essentially like reach your future patients, especially now, Casey, you didn't even mention it. Like now with physical therapy, the majority of the country, or at least a decent chunk, well, the country now as a whole pretty much technically has direct access. It's just that it's different in varying states. And so for those of you that have no idea what direct access is, it's pretty much now, and states kind of have their own rules about it. So like here in Texas, it pretty much doesn't exist, even though it technically does. But anyway, but for that, essentially, like for the longest time, physicians had to refer to physical therapists. Like you could not see a physical therapist without a doctor. Well, sorry, a physician writing a script for you to go see a PT. Whereas now with direct access, you can come to a physical therapist first, because I mean you're skilled with all the tools of like differentially diagnosing and figuring out what's going on. And then if you're saying, okay, this is really not a PT thing, like you really do got to see a doctor first, then yeah, like you send them to the doctor or whatnot. But I think that's kind of cool because it allows us to really, and Greg Todd, our mentor, and a few other people really talk about it, but it allows you to really now like speak to your future patients directly. because you're wanting them to come to you because you know you can help them. And if they've been spending the last 10 years on medications because they don't know anything else, like no one's really told them or whatnot, then we have that ability to do that. And so we can even do a live one time, just really saturated on that with all the questions that you guys have, especially from the perspective of a pre-PT student that's concerned about whether it's really the whole money thing, because it's an investment now, guys. You go back 20 years, it wasn't nearly as expensive as it is now. And so it is an investment. So you can't just say, oh, okay, I want to do PT. You can't just wake up one morning anymore and just say, all right, let me just go see what programs are out there. Let me go see what it's all about. And I think there's still a percentage of people that do that and they somehow get into the field, but you'll notice they're the ones that they're either not enjoying it as much or they're not as effective because they're not passionate about what they're doing. And so it really does change the whole thing. So just know that you want to put your money where it's going to be valuable for you. It's an investment. Like for our university, Casey, how much we paying? We paying like what?
Just over 30 a year.
Yeah, man, like that. It's ridiculously expensive, and so they have scholarships and all that other fun stuff. But overall, man, it's no joke. Some other schools are not as expensive as ours, so don't freak out. But it's a whole lot more of an investment. People are coming out of school with maybe like 70,000, 100,000, 150,000 plus in debt. And so if you know you're going into it because it is the profession for you, and the rest is over because you're going to be successful in whatever you seek out to do. And the key with that is never stopping to learn. So for any problem that is there's usually an answer for it. You just have to find it. So if it's the money things, like how am I going to make my money and still be effective and still do what I like and not really compromise, my values and whatever, like we could talk to y'all about that even, And so that stuff's all there, but know that you're getting into a profession that you understand first, and a profession that fits everything that you want in a career. Because you're going to be doing this I used to say you do this for the rest of your life, but I think now with understanding what you can do with PT, like I might do one thing in PT for like 5 years and then switch it up, maybe have my own practice and then maybe leave that running and then go travel and do other things. I mean, you can do so many different things, but understanding that this trajectory is really like post graduation, that's a good chunk of your life right there. In this world of movement. Know that it's for you. And so that's why we wanted to come on, talk about this. If you guys have any more questions, feel free to still comment below. We can answer them directly or include them in future calls and whatnot. But I hope this has been helpful, especially to those that were trying to figure out if this is the profession for them, or we're just kind of like, man, I just kind of found out about PT last month. What's it all about? You know what I'm saying? So.
Yeah. So here's the last thing I'm gonna say before we do our little announcements and close up and everything.
Yes,
there's been a lot of talk about is 100,000, 80,000, 150,000 worth the money, and you have to look at it like now that you know everything you can do with your degree. Now go back and reassess. Is it worth the $100,000 worth in debt or just in cash if you have it or your family has it or something like that? With everything you now know that you can do from the clinical side, from the business side, and from the marriage of those two, is it worth the money? I mean, I can't answer it for you. I know for myself and I know for a few others, but now that you know some other things you can do to your degree, like this is not an arts degree or not to those degrees that you just go to college and you can't do anything with. This is not one of those things. We just spent 40 plus minutes saying everything you can do to make money. Oh, I think I'm freezing. Everything you can do to make money with this. So like just reassess and see if for yourself, like, is it worth the money? So thanks for tuning in. What are the announcements we had, Joseph? You had some pre-live.
Yeah. So first announcement is next week, Wednesday, we're talking about money, period. Last week when we did our live, There was a lot of questions, and we touched on it a little bit, but we didn't really answer any questions. Next week, we're bringing on one of our friends. Y'all will see some of our posts pretty darn soon, just kind of telling y'all about, prepping for it and all that stuff, whatever. But you guys are going to want to be on that live, especially for those of you wondering, like, can I do physical therapy? What Casey was saying, and still get out of, that $100,000 worth of debt? How can I even avoid the debt? So one of our team members for pre-PT Grind, Molly, I believe, like, she's graduating without
Molly Knight.
Yeah, she's graduating without any debt. If I'm remembering correctly, if I'm wrong, I'm sorry. I may have just lied, but I believe that's the case, and I think she had posted that somewhere. And so there are ways to do that, but let's talk about it. Don't be afraid of something until you really hit it, head on, and understand it first. And then we make the decisions from there. And you guys can talk to us personally, message us directly. We'll talk about that and really kind of help you guys on that journey. And then we have another announcement coming up soon. We'll give it a little more detail later. But in about a week and a half, we'll have a live special where we'll bring a team of individuals that are graduating on the 6th of August. And it's 4 friends that essentially from their freshman year till their graduation date, like how their decision to be ride or dies from the get got them through the entire pre-PT and DPT process and where they're going to be in the next few years. And so you guys are going to want to hear that from a story standpoint, because we learn from stories. We learn from other people's experiences. And so you'll hear more about that. We got some great things. Always look out for our podcast. Next week, Wednesday, we're going to have our next one, Fire-Filled, every Wednesday after that. We always have our lives. You'll see us more active now, just trying to serve you. Always reach out to us if you guys need us to address anything, because we want it to be pertinent to what you guys want to understand as you are engaging in this field of physical therapy.
All right. See y'all next week.
That's been real.